Hello, everyone. My name is Kerri, and I work with the Berrien County Health Department and the Area Agency on Aging. And I would like to talk to you about a common pain medication that is often prescribed called opioids or opiates. What we do know is that adults over the age of 60, 80% of those people use at least one prescription on a daily basis, and 50% of those people use at least 5 or more prescriptions or medications in one given day. When we take more medications, it actually does increase our risk of negative drug interactions. And what I mean by that is if you combine some medications with other medications or vitamins or supplements, it may have a negative result on your body. Likewise, if you took a medication with some particular food or drink that you weren't supposed to use with that, it could have a negative impact on your body, and it could be as simple as a headache or dizziness. Sometimes it could cause high blood pressure. It's just really important to understand when to take your medications at the right time of the day and what to take them with. The other thing to remember is that as we get older, things do slow down. But what is of most importance, what slows down, is our liver and kidney. And all of our medicine that we take has to be filtered through our liver and kidney. And what that means is when it slows down, it might take longer for you to feel the effect of a particular drug. If you are one of those people that have 5 or more medications to take a day, I cannot stress enough how important it is to talk to your pharmacist or doctor about your medication regimen, when and what to take them with. What happens is if we don't know, a lot of us are ending up in the emergency room because there's been a medical condition that we've created that possibly could have been avoided just by talking to the pharmacist or the doctor. So now let's talk about pain. 65% of older adults report having pain on a daily basis. Over 30% of older adults actually report chronic pain, and chronic pain is described as a pain that lasts for 3 months or longer. And what happens when we have chronic pain is that it tends to have a negative effect on our physical health, our mental health, our sexual health, sometimes our heart health. It does interfere generally with our daily activities, how we think, how we sleep, what kind of mood are we in. When someone is in chronic pain, they're often prescribed opioids. Opioids are the most potent medicine that you can get prescribed for pain. So what exactly are opioids? For many years, we've often heard in the newspaper or on television about an opioid epidemic. A lot of people don't really know what that is. Well, opioids themselves come from an opium plant or a poppy plant. Those are not grown around here. They're often grown in warm climates, more so in the Arabic nations. And what happens is they take parts of that opium plant and synthesize it into a pill form. So the pharmaceutical industry has found a way to take parts of that opium plant and create a pill that helps with pain. When someone is prescribed an opioid, it actually changes the way a person experiences pain. How opioids actually work is that when you ingest a pain medicine or an opioid, it attaches itself to a chemical in our brain that is called dopamine. And dopamine is a natural chemical in all human beings, and it is responsible for making us feel good, feel pleasure, feel rewarded. The pill also attaches itself to the nerves that are making you feel the pain. So when you are attaching it to the pain nerves and then attaching it to the chemical that makes you feel good, you feel less pain and you feel better. That is the intention of any opioid that is being prescribed to you, and is actually an effective way of stopping the body's ability to feel pain in the first place. Here I have a list of the most common opioids that are prescribed today. They are codeine, Demerol, Dilaudid, Duragesic, or skin patches containing fentanyl, which is probably the most potent pain medicine there is out there and often prescribed for end-of-life patients, heroin, hydrocodone or Vicodin, Loratab, Loracet, Norco. Those are all in the same family of medicine. Methadone, morphine, Oxycontin, oxycodone, Percocet, Percodan, Tylenol 3 with codeine, and Ultram. So if you are prescribed any of those medications that we just went through the list of, these are some possible risk and side effects of the opioid use. One, your body could become tolerant of them. And what I mean by tolerant is that your body becomes used to taking that medication, and over time it may not have the same effect. You could become physically dependent on opiates. If you remember a couple slides ago, I talked about how when you take a opiate, it gives you that sense of pleasure and reward and that good feeling. And some people just like to have that good feeling, even though the pain may not be decreased, and they might become physically dependent on that pain medication. Another risk or side effect could be it actually increases your sensitivity to pain. Constipation is a very common side effect of opiates. Nausea, vomiting, dry mouth, people have experienced. Everybody is different in what they experience, but those are some of the more talked about side effects. Other people might feel themselves getting sleepy or dizzy a few minutes after taking the medication. Others have expressed that maybe they're starting to feel more sad, more depressed after taking the medication. That could happen, and if that does happen, those are good conversations to have with your doctor. And other people have reported that they have been itching or sweating more than usual after taking that medication. So that was a brief summary of opiates as a pain medication. If you are one of those people that are prescribed an opiate, please talk to your doctor, your pharmacist, about all of the interactions and information you should know. If you would like to contact me, my phone number is here, and I also have some more reading material. If you would like a packet of information, I can get that to you. Please just give me a call. Thank you.